Acute lymphoblastic leukemia, or ALL, is a form of cancer of the blood. It's derived from the lymphocyte-producing cells in the bone marrow. Acute leukemia develops when these lymphocyte-producing cells, for reasons we don't necessarily fully understand, stop maturing properly and or also gain the ability to divide or proliferate more quickly. And this means that you have a build-up of these very immature lymphocytes or lymphoblasts within the bone marrow. And this means that the normal bone marrow cells are crowded out.
Well, when Josh was about 2.5, he started going back to crawling rather than walking. First thing in the morning, he'd say his legs were too sore to walk, and he'd get out of bed and crawl around for the first half an hour or so, and then start walking after that. That was the main symptom. He had pains in his legs, which would come and go. He was also quite pale at that time.
Some of the symptoms are anemia, so tiredness, short of breath, lethargy. Infections, high fevers, maybe mouth ulcers, bleeding, bruising and rashes. Together with most children will have enlargement of some lymph nodes, so often around the neck or in the groin, and often their liver and spleen may also be enlarged. The other symptom which is quite common is bone pain, and this is one of the symptoms that actually is quite prominent and often takes some time to diagnose. The initial treatment, whilst we're waiting to confirm that diagnosis, is mainly supportive. So that might include fluids for hydration, antibiotics if they've got an infection or a fever, maybe a blood transfusion or a platelet transfusion. Chemotherapy is a general term really that encompasses a lot of different drugs, and these can be given in tablet form, or they may be given into the bloodstream directly, or they may be given into either muscle injections or subcutaneous injections. And there are some drugs that are given into the central nervous system via a lumbar puncture called intrathecal chemotherapy.
You get the nausea and just feeling tired, and the hair loss, obviously. Joshua lost his hair 3 times throughout the treatment, and that was each time the treatment was intensified. It's a 3-year course of treatment, and the first 9 months is intensive treatment, and then the rest of that's maintenance therapy. So I think it was in the first 9 months that he lost his hair 3 times, probably once every 3 months or so.
The majority of children with ALL will go into remission after their initial treatment, and over 75 to 80% of those are cured. So we have a very good response rate. There is a small proportion of children that won't go into remission, and those children will probably require individual care by their individualised care rather by their specialist, and may require intensification of treatment, for instance with a stem cell transplant.
It sounds initially very daunting and very scary, but I think once you realise, you start to adjust and you start to recognise what's going to happen and become familiar with the treatment, you do feel a lot more at ease. So it's not all as fraught as it is in the early days.
I think the things to bear in mind are this is a curable disease and the majority of children will be cured. That your primary treatment centre and your shared care centre will do whatever they can to enable the child's treatment to go as smoothly as possible and to have as minimal disruptions to the child and to the family and brothers and sisters.